So we're going to begin. My name is Joy Moses. I am the Research Director at the National Alliance to End Homelessness. Welcome to this second installment of our webinar series, Researching an End to Homelessness, Election Year Policy Ideas. To view past installments of this series and to register for future ones, please visit the events page on our website, endhomelessness.org. But we want to make sure that we jump directly into today's discussion. We have great speakers for you today. We are joined by Jill Khadduri of Apt Associates and Beth Shinn of Vanderbilt University. They are the authors of a recent book, In the Midst of Plenty, Homelessness and What to Do About It. Before we get started, I'll just say a couple more things as more of you gather. For a better viewing experience, you might want to try the side-by-side gallery view. You should be able to find it on the panel that is available probably at the top of your screen. As we go along, please feel free to add your questions for the panelists to the Q&A section. And you also will have the ability to chat with your fellow audience members in the chat area. So feel free to do that as well. So with that, I am going to turn the floor over to our speakers and get ready to hear a very informative presentation. Beth and Jill.
Well, thanks so much for hosting us, Joy. And thank you to all the people who've joined us today. As Joy said, Jill and I have written a book that surveys the evidence about how to end homelessness. The book is organized around 4 questions. Who becomes homeless? What causes homelessness? How do we end it? And how do we prevent it? So the first question is, who becomes homeless? Over 500,000 people are staying in shelters or found in street counts on a single night. And we know that we miss people. But many more people experience homelessness over longer periods. Over the course of a year, more than 3 times that many people stay in shelters. Back in 1990, early in the current epidemic of homelessness, a telephone survey of people living in regular housing, no homeless shelters or barracks or jails, found that 7% of adults in the United States said that they'd been literally homeless at some point in their lives, and twice that many if we count doubling up. So most homelessness is a temporary state that people pass through. That gives us many points of intervention. How do we prevent homelessness? How do we help people escape it? How do we stop generating? On a single night, there are roughly equal numbers of individuals who are sheltered, individuals who are unsheltered, and families, most of whom, thankfully, are sheltered. Infancy is the age at which an American is most likely to stay in a homeless shelter. Children are a blessing, but they require the parent either to pay for costly care or to stay home to provide that care. Rates of homelessness stay high in the preschool years, and they drop when children reach school age, and childcare expenses also drop. Homelessness rises again in adulthood. Although there are not many people in their 60s and older who are currently homeless, that number has been rising in recent years and will continue to do so. Older adults face severe health challenges. So when we think about the face of homelessness in America, we should think not only about the man on the left, but also about that child on the right. Now Jill's going to talk about some of the causes of homelessness.
Thanks, Beth. We have 3 powerful pieces of evidence that what caused the current epidemic of homelessness is a housing affordability crisis. What I mean by the current epidemic of homelessness is the homelessness that began to be apparent in the early 1980s and continues today. One piece of evidence comes from history, what was going on when the current epidemic started. Another piece from geography, where rates of homelessness are highest. And the third piece is from what we know about what prevents homelessness. Poverty rates are high in the US compared to other developed countries. Increasingly, poverty is deep. People are not just living with incomes below the poverty line, but below half the poverty line. In the late 1970s and into the 80s, poverty remained and began to get deeper, and at the same time, rents increased, creating an affordability crisis. You can see on this slide that the affordability crisis began. Beth, if you could flip back one.
Sorry.
You can see that it began to be apparent in the mid-70s, and then became even more of a problem, the shortage in the number of units that are available to people in the bottom quartile of the income distribution during the 80s and into the 90s as homelessness grew. This map shows that an earner's hourly wage would have to be substantially more than the minimum wage in order to for a household to be able to afford the fair market rent. That is to say, rents at about the middle of the housing market. There is no state in which a family with a full-time minimum wage earner would be able to afford the rent. In some states, the situation is worse. This slide illustrates the relationship between housing costs and high rates of homelessness. It shows the largest 25 metro areas in the US. The left axis is the rate of homelessness, that is to say, the point in time count of homeless people divided by the total population. The bottom axis is median rents. You can see a clear relationship here. Homelessness is higher in places with particularly high rents. Those metro areas, New York, Seattle, Los Angeles, San Diego, Washington, are affluent in some ways, but there is also a great deal of income inequality in those metro areas, and therefore many poor people who cannot afford the high rents. This is the final piece of evidence that homelessness is fundamentally a housing affordability crisis. A rigorous study of the effects of providing housing vouchers to families with children shows that having a voucher essentially wipes out the risk of homelessness. Later, we'll provide additional evidence on what housing vouchers do when they're offered to people who have already experienced homelessness. Among those living in poverty, why are some groups particularly vulnerable to experiencing homelessness? In the book, we discuss this at length, with particular emphasis on the role of racism and social exclusion. Black people are particularly vulnerable to experiencing homelessness because of the legacy of discrimination and also because of current discrimination. For example, in 2018, Black men earned only 75.5% as much as white men, and Black women earned only 81.5% as much as white women. For the past 3 decades, unemployment has been roughly twice as high for Black. This is not a difference in skills and experience. A paired testing study had people with the same education and experience answer job ads, but they used names identifiable as African American, like Lakeisha or Jamal, or not, like Emily. And the study measured differences by the person's apparent race in being called back for an interview. The difference between being Lakeisha and being Emily was the equivalent of an 8-year difference in experience. Wealth disparities are even greater than income disparities, and this means that a Black family or individual in a housing crisis is less likely to have a relative or friend able to provide the help needed to prevent homelessness. These wealth disparities result from a long history of legal discrimination in home buying. Black families were unable to benefit from the accumulation of housing wealth following World War II that white families were able to accumulate and to pass on from generation to generation. And paired tests that measure housing discrimination, similar to those paired tests I talked about in the context of income discrimination, showed that housing discrimination continues, despite the fact that it's been illegal since the late 1960s. And then there's the disparities in rates of incarceration. that were exacerbated by the so-called war on drugs, and the much greater likelihood that people of color will be incarcerated as a result of minor drug charges. The upshot of that is that 1 in 10 Black children as of 2015 had a parent in prison or in jail. People with disabilities have the challenges associated with their disabling conditions, but they also face discrimination in the housing and job markets, and income benefits for people with disabilities are too low for affording housing. So those are the causes of homelessness, a housing affordability crisis that is particularly hard to cope with for people who also live with results of social exclusion. And now Beth is going to talk about the solutions, what we know works for resolving homelessness and preventing it.
Thanks, Jill. Here we have evidence about programs that end homelessness for particular groups, and also about the impact of broader systems level changes. The Family Option Study compared different interventions for families recruited in homeless shelters. It showed that offering families housing vouchers that reduced their rental costs to 30% of their income reduced every measure of homelessness and residential instability. But more than that, it had radiating impacts. It reduced separations of children from parents, children's school absenteeism and their behavior problems. It reduced families' food insecurity. For adults, it reduced domestic violence, substance abuse, and psychological distress. That is, vouchers provided a platform for families to solve other problems on their own. As one mom put it, for me to actually have a nice house for our children without having to be completely worried about rent for this month, because my husband is trying to go back to school full time, and so am I. We know we're supported and we don't have to worry about losing the house because we're trying to go to school and to work, and we're safe, we're okay, and we'll get things back on track. Further, the study showed that few families were ineligible for vouchers, lease-up rates were high, and all these benefits cost only about 9% more than the usual care in communities that we studied. Vouchers alone end homelessness for most families. People with disabilities often need more. Supportive housing, that is, subsidized housing with services under people's control, ends homelessness for people with serious mental illnesses and substance abuse problems. The traditional approach here is sometimes called the staircase model, in which people earn their way to more independent housing by addressing their behavioral health challenges. The housing first approach bypasses the steps in the staircase model and gives consumers immediate access to independent, permanent housing without preconditions and with services under their control. There's strong experimental evidence that this approach works better than the old staircase model. It ends homelessness without exacerbating substance abuse, because services work better when people choose them freely. In addition to describing specific program, our book discusses the homeless service systems and efforts like coordinated entry to make it more efficient and effective. When we make coordinated efforts and put resources behind them, there's evidence that we can end homelessness. We cut veteran homelessness nearly in half with the combined efforts of the Veterans Administration, the Department of Housing and Urban Development, and state and local governments. And we reduced chronic homelessness by increasing the supply and the targeting of permanent supportive housing. Finland has largely ended literal homelessness with a concerted housing first approach. Note that the light blue bars here, institutional placements, would not even be counted in the US figures. The evidence is strong that we can end homelessness for people who experience it, but we also need to prevent homelessness for people on the brink and to stop generating homelessness. Prevention efforts are difficult to design well because it's hard to say who would become homeless in the absence of the intervention. It's not enough for a provider to say, oh, well, 90% of the people who used my program avoided homelessness. I can tell you how to get it to 100%. Just give your services to millionaires. So bad targeting can sometimes masquerade as effective prevention programming. Every study that is looked finds that you get most impact by focusing on the people with the highest needs, even if you also have more failures there. We have strong evidence that some specific prevention strategies work. As Jill noted earlier, there's experimental evidence that housing brochures, the same housing vouchers that ended homelessness for families who were already in shelters in the family option study, also prevent it for poor families. There's evidence from multiple studies that New York City's home-based program, which is essentially good old-fashioned social work backed up with some cash resources, works for both individuals and families. And although most people who get evicted do not go on to become homeless, there's good experimental evidence that cash help can reduce that number even further. There's weaker evidence for some additional prevention programs. Legal help reduces evictions, but we don't know that it also reduces homelessness. Ongoing rental subsidies, more modest than those provided by housing choice vouchers, prevented homelessness among people with HIV in one study. And universal screening for veterans and prevention was part of the full court press that reduced homelessness for veterans. Now Jill will talk about some broader strategies.
Thanks, Beth. As Beth said, I'm going to talk about prevention in a broader sense, how to change the broader societal conditions and policies that are the causes of homelessness. The most powerful thing that we can do is to expand the Housing Choice Voucher program. In the last 20 years, the program has expanded from only 2 million to 2.2 million households. There's now finally talk about a universal voucher program, which is great. Vouchers present homelessness, and they work just as well for Black people and other people of color as they do for white people. A universal program does not mean a program for all US households. We would keep the current income limit of 30% of area median income. That varies across the country, but it's roughly the equivalent of the poverty line. Getting to a program that was available to all poor renters would require a phase up. Maybe adding 300,000 units a year to the current 2.2 million. Adding vouchers at that pace would make public housing authorities much more willing to set aside vouchers for people experiencing homelessness, as well as beginning to chip away at the housing affordability crisis that is such a fundamental cause of homelessness. Some areas of the country also need to work on expanding the supply of rental housing. That could be done by greater funding for the National Housing Trust Program. And another equally important way of increasing supply is by overturning exclusionary zoning. For example, reducing barriers to producing multifamily housing in many neighborhoods and reducing barriers to subdividing existing housing units to create more affordable housing. Now, the housing affordability gap can also be closed by strengthening the income side of the social safety net. For example, evidence shows that there's plenty of room to raise the minimum wage without a negative effect on the supply of jobs, and we go into that in the book. The earned income tax credit works well for those who are able to work. SSI and SSDI income support could be raised to levels that make housing affordable, or that would require only a small rent subsidy to make housing affordable for people with disabilities. More widely available low-cost childcare would reduce a major barrier to working for families at risk of homelessness. An expanded voucher program would go a long way toward preventing homelessness, but we also need to work directly on social exclusion. We have evidence that vouchers work better. More people succeed in using them to find housing units in places that prohibit owners from refusing to rent to a household simply because the household will be using a voucher to pay part of the rent. An increasing number of states and cities are enacting such laws, but it would be really good to have a national law. And we also need better enforcement of the national fair housing laws that are already on the books. So we know how to end homelessness. We know what causes it. We know how to help people leave it. We know how to prevent it. What it takes is political will.
Thank you. So at this point in the conversation. We're going to shift to a combination of moderated facilitator questions, and then I'm going to also reach to some of your questions that you started in the chat. Please note that I put a link to Beth and Jill's book in the chat. It is In the Midst of Planning Homelessness and What to Do About It. It can be found through major booksellers like Amazon.com. So one of a big question these days is related to COVID-19 and the recession. You published your book much earlier this year before both of those crises began, and they are changing, they're very much changing the world we're in, impacting the number of people who may be experiencing homelessness, ways to safely house people in homelessness, but also leading to more money coming into systems. Could you talk a little bit about how COVID-19 and the recession affect the way you think about some of the issues raised in your book?
So in some ways, the COVID-19 crisis just makes the expansion of the Housing Choice Voucher program even more important. More people are on the brink and more people can really use help. But most of the people who are facing eviction right now are not going to actually become homeless. That's the last thing people do. They go double up with their friends and family. They try everything to avoid becoming homeless. So we can't forget the people who are currently already homeless. And there we've got some resources thanks to the CARES Act. Emergency Solutions Grants money can be used to help people who are currently on the streets get off the streets and into housing with some short-term subsidies. And then we can ask housing authorities to target their vouchers as those become available to the people who are exiting that Emergency Solutions Grant program if they still need more help.
So I would just add to what Beth said that the causes of homelessness essentially remain the same, and they're likely to get worse. Poverty is likely to grow. Deep poverty is likely to grow as a result of the pandemic. Housing costs could drop, but they won't drop low far enough. Rents won't become sufficiently affordable because there's a floor below which an owner of housing simply can't afford to keep the housing going. So that there'll be more deep poverty, and and housing will still not be affordable. And as Beth said, the solution is still the same. The solution is to provide an adequate number of deeply targeted and long-term housing subsidies.
COVID-19 is also exacerbating the problem for African Americans and Latinx peoples and Native Americans. The same folks who were at greater risk of homelessness before are also disproportionately affected by this disease, in part because they're living in more overcrowded circumstances and they have the kinds of jobs that don't allow them to sit at home and watch Zoom and be protected.
So I see an interesting conversation that developed in the chat around affordable housing, essentially. I'll mention two parts of the conversation. One of them is, how did this affordable housing crisis start in the historical sense? And the second part is, there's some folks who are very much interested in public housing and the role that could play, and they are noting that the Finnish example that you cited, that public housing was a part of that. So could you talk about those two things?
Mm-hmm. Well, let me start with the first question. What happened in the 1960s and 1970s basically is that the U.S. housing stock got a lot better. There were a lot of substandard units without full facilities, without indoor plumbing, without full kitchens. That essentially went away in the period after World War II, and by the mid-70s, there was very little of that kind of severely substandard housing. But at the same time, so we had this much better housing stock, but its costs went up. Its costs went up in the 70s in part because of the 1970s energy crisis, but also in part because we simply put a floor on what an adequate housing unit was through regulation that may have been appropriate regulation, but what happened is that people's income simply didn't keep up. Poverty became worse, and increasingly it became deep poverty. So while you had rising rents in the 70s and into the 80s, you did not have rising incomes at the bottom of the income distribution that could keep up with those rising rents.
Mm-hmm. I mean, the other thing that's important to note is that inequality got a lot worse, and it's continuing to get worse. And you might think that it's only the bottom of the income distribution that matters, but people at the top of the income distribution are also bidding for that same land. So for example, a lot of single room occupancy hotels got closed down and replaced by luxury dwellings. And so much of the poverty, much of the housing that was available for folks who were poor also disappeared during that period.
And the second part that I had mentioned, should we be talking more about public housing as a solution?
Mm-hmm.
I don't think it's necessary to have public ownership of housing. It's certainly the case that a lot of European countries, including Finland, have much larger social housing sectors than we do. They also have are likely to have, most Western Europeans have housing allowance programs, which are not identical, but similar to housing vouchers, but they're much more broadly available. A question that I saw in the Q&A was, don't housing vouchers simply drive up housing costs? And the answer is they don't. I mean, we go into this at fair amount of detail. There's a lot of research literature in this, and what it shows is that an infusion of housing vouchers into a housing market at any imaginable pace is simply not going to drive up rents. The evidence is not there.
Mm-hmm. And in Finland, part of what happened is that a nonprofit organization cooperating with government bought up a lot of the housing and made sure that it stayed affordable. And so, after the last real housing crisis in the Great Recession, a lot of housing that was foreclosed on got bought up by private equity companies and rented back at sometimes exorbitant rates to people in the community. If instead of allowing private companies to buy that up, if the nonprofit sector, bolstered by government, by cities, could buy up some of that scattered site housing that's all over the city and make that available to poor people, that would be a great thing to do. But public housing tends to be concentrated. And one of the moves to the Housing Choice Voucher Program was to try to deconcentrate poverty, at least a little bit. It hasn't been completely successful there, but it has more potential.
And as I said in the presentation, there are certainly parts of the country that have a shortage of rental housing, mainly the coastal areas, in which there really needs to be a supply side response, as well as more housing vouchers, an expansion of the National Housing Trust, continuing to have the low income housing tax credit program. I would target it better, or have an add-on that is better targeted geographically to the places that really need it, but also importantly, relaxation of zoning requirements and other requirements that make it difficult in some parts of the country to develop an adequate supply of housing. That's also important, particularly in some areas of the country, not everywhere.
I think Kevin in the Q&A raises a related question. I want to turn to that. I think you're starting to touch upon it, but what level of government is most responsible for housing production, and what can be said and done to make sure that there are enough housing units available and ones that don't exacerbate segregation?
Mhm. You want to take that, Jill, or shall I?
Sure. I mean, increasingly, state and local governments are providing their own resources for expanding the housing supply and in some cases for adding rent subsidies to the federal housing vouchers that already exist. That's particularly the case, for example, in California. On the other hand, there simply are not the resources at the state level to substitute for the rent subsidies that really only the federal government has the taxing authority to provide on to the extent that are needed. I alluded to something that I think would be a good idea, which would be to expand the low-income housing tax credit by providing an add-on that can only be pulled down by states if they come up with a matching requirement. The places that don't need that kind of supply program response would not be willing to appropriate money for the match, but the places that do would be able to and would draw down more tax credit.
Mhm.
So I'll shift a little bit. We had a population-specific question as well. The questioner, Alicia, is curious about senior citizens and their high rates of homelessness and how do they figure into your suggestions for solutions. She's specifically concerned about their ability to pay with subsidies because they might be priced out due to their limited income.
Mhm. So currently, senior citizens are at lower risk than other groups. That's in part because we have better income supports for older people. I mean, Social Security has been a tremendous success story in moving a lot of senior citizens out of poverty. But we know that older people, that the average age of individuals who become homeless is increasing. That's not true for families. Families are largely driven by having young children. Family homelessness is largely driven by that. For individuals, the average age is increasing with kind of late baby boomers at high risk. And so we expect there to be an increasing problem among senior citizens. Of course, senior citizens will come with additional health issues that need to be dealt with as well. So we do need to be planning for that influx. We know that it's coming and we need to be planning for it. It's not the crisis now that we have among younger people.
I think I'll turn to one of the, or a couple of the questions related to housing choice vouchers. So one of our audience members is curious about intersections with some of the issues you raised about Black Americans and discrimination. They're interested in whether or not your book discusses how in your book, do you discuss how the current background checks for housing choice vouchers can adversely affect Black Americans?
Mm-hmm. Well, the housing choice voucher, the background checks for the housing voucher program that are imposed by the federal government are actually a little bit more lenient than many cities and local housing authorities have imposed. And certainly those should be rolled back. What we found in the family options study was that very few families were ineligible for housing choice vouchers. We thought that that might be a problem. Actually, many more families were judged ineligible for transitional housing than for the housing choice vouchers. And they were thrown out of the rapid rehousing program because they didn't have sufficient incomes. But almost everybody was eligible for housing choice vouchers. That said, I think we should try to minimize those requirements and make that program, since it's such a successful program, available to everybody.
So somewhat relatedly, I'm going to ask a difficult question, but it hangs over all of these discussions. We often have lengthy analysis about racism and how it impacts our issues. Do you have thoughts about how to address the racism that you identified and how homeless services systems can help with that?
Mhm.
Well, let me say first that there's actually a substantial body of evidence. There have been studies of, who succeeds and to what extent they succeed in using a housing choice voucher over the years. And interestingly, success rates among Black and Latinx households are just as high, sometimes even higher than they are among white families. So an expansion of the housing voucher program would help overcome, in my mind, some of the racial disparities that lead Black families and individuals to have such high risk of becoming homeless, which is not to say that's enough. I talked about a national source of income discrimination law. We've got a lot of evidence that works, that in places that have such laws, the success rates for the housing voucher program are higher. And we also have all of this evidence from the paired testing that HUD sponsors a study every 10 years or so. And there's really strong evidence that racial discrimination, discrimination against Hispanics, discrimination against Native Americans, and so forth remains, despite the fact that it's been illegal for decades now. And so, really working on more robust enforcement of the fair housing laws that are already on the books is a very important thing to do.
And the employment and discrimination laws that are on the books, and reducing the excess criminalization of everyone that's visited much more strongly on African Americans. So homelessness is kind of the worst manifestation of racism and inequality in our country. Anything that we do to attack racism and enforce fair housing and other equal opportunity kinds of laws will help on the homeless front too. But homeless service systems need to examine themselves as well, and to make sure that they're trying to reverse discrimination within their jurisdiction. So
there's a intersecting back and forth here between the discussion about housing choice vouchers and race. Robert also was interested in, is there anything we can do with housing choice vouchers to reduce discrimination from landlords, and how that affects outcomes from that program?
Mm-hmm. So,
well, certainly, certainly discriminating, simply saying I don't take vouchers when somebody calls and asks to rent your apartment, that's often really disguised racism. What the landlord really is saying is, I don't want Black people living in my building. So source of income laws, they have to be enforced. There has to be funding for fair housing organizations to make sure that those laws actually have some teeth behind them, through litigation that makes owners pay attention.
We do a much better job of documenting housing discrimination than we do about ending it. And that really is an enforcement issue, and that requires funding of enforcement efforts. And the remedy for having discriminated should be setting aside units for the group that has faced that discrimination.
So I'll just make a brief announcement. It's been noted that the default for the chat function might be all panelists. So you might want, if you want to communicate with the larger group, please look at the drop down menu there. I'm going to turn to another issue, which is housing first. This is a question that I know we get a lot at the Alliance, and I see one of these questions in the Q&A. The basic gist of it is, does housing first really work? Why would that be better than the stair-step model that you mentioned, Beth, earlier in the presentation? I think for some people it seems a little counterintuitive not to help people before you give them housing. So if you could discuss that a little bit more.
Sure. I was involved in one of the first experiments looking at housing first in the Pathways to Housing model in New York. And these were folks with long histories of mental illness, long histories of homelessness, lots of hospitalizations, and they were required to have been literally on the streets, not in homeless shelters, at least 2 out of the 4 weeks before they came into the program. So we were recruiting people directly from the street, and they went either into kind of the staircase approach where they worked with outreach workers to try to make them housing ready, to get them clean and sober so that they could come indoors, or they went directly into apartments with services provided by an ACT team, but under people's control, no prerequisites. And at the time, that was a very radical approach. And what we found, the bottom line was 99 fewer days homeless in the first year for folks in the Housing First approach with no additional substance abuse. So how's that possible? How's it possible that programs that require you to be clean and sober to come indoors don't do better than programs that don't make that requirement? And what we found was that the programs that required people to come indoors were essentially, that require people to be sober to come indoors were essentially sorting people more than they were treating people. So the people who got indoors in those programs were using fewer substances, but the people who were randomly assigned to those programs and were excluded were using more substances. And if you looked at all the group that was randomly assigned to the staircase model, they weren't different from the folks who were randomly assigned to the Pathways model in their substance use, but they were vastly different in their homelessness. That's been replicated in Canada in the 5-city at-home Chez Soi study, really large-scale study, showed exactly the same effects.
So I see a question from Ronald, who I think may be from Los Angeles. He's really interested in you discussing crisis response models. Did you examine them in your book, and what are your thoughts on those?
So the main crisis response models are homeless shelters, and we're going to continue to need some of those, though we hope that stays there as brief as possible. And rapid rehousing, which are short-term rental subsidies. And we looked at those in the family options study, and we found that they really weren't a lot better, they weren't any better than the usual care in the communities, which involved more use of homeless shelters. The problem is that 3 months or 6 months of help typically isn't enough for somebody to raise their income, somebody who's been homeless, to raise their income to the point that they can take over the lease and pay the full amount. And so that's why we think we really need long-term subsidies. I think there's still some research to be done as to the level of those subsidies, just how long they need to be. You know, for example, for families with a subsidy that enabled the youngest child to get to school age be enough because homelessness goes down at that point. I think there's still some research to be done, but I think we know that the long-term subsidies work a whole lot better than something that's short-term.
Yeah, and I agree with Beth. I mean, we're just finishing up, we at ACT Associates are just finishing up another study of rapid rehousing. I'm really surprised by how short those rapid rehousing subsidies often are. We're often talking 6 months, 9 months, even nothing more than first and last month's rent. That's clearly not enough, particularly as rapid rehousing is now being targeted increasingly on the highest needs families and the highest needs individuals. So it's clear that that short an amount of subsidy simply is not enough. But what is enough? 2 years, 3 years? I think we really don't know. Also, as rapid rehousing is being increasingly used for people with high needs, the program has to be rethought in order to make it more of a bridge to permanent supportive housing with access to the kinds of services that people with behavioral health challenges and other kinds of situations that are going to make it very hard for them to be able to afford housing within a short period of time can be addressed.
Mhm.
So I see a couple questions from Lauren and Jen about rural areas. Do you have any thoughts that you could offer to those communities that may have less affordable housing available or less resources to address homelessness?
Jill, do you want to?
Sure. I mean, I think there's a lot of variety among rural areas across the country. It simply is not always the case, and not the case in a lot of places, that there is no rental housing. Excuse me, there is rental housing in rural communities, and housing vouchers actually are pretty effective in rural communities. We do know some of the ways in which the face of homelessness is different. It's more likely to be unsheltered in rural areas, somewhat more likely to be family homelessness. And there's more, we think, more of an inflow of first-time homelessness in rural areas, less repeat homelessness than there are in more urban and suburban kinds of areas.
I also notice in the chat a number of comments about what people need in terms of mental health and substance services, and to the extent to which mental health and substance abuse are kind of causes of homelessness. So let me just say a couple words there. First, the housing first model of supported housing isn't get somebody into the house and close the door and run away. It involves continued availability of support services. The services are under tenant control, and that makes sense because services work better when people choose them. I mean, kicking a substance abuse problem is hard enough when you're committed to it and when you've got great treatment. Foisting substance services on somebody before they're ready isn't going to happen there. But the chances that somebody's going to get ready when they're living on the streets are not great. So get them in housing, make those services available. The other piece of that question is, well, to what extent are these causes? And particularly you get that for mental health. You know, is mental illness a cause of homelessness? And, you know, why should the penalty for mental illness be homelessness? That's because of the level of our disability assistance programs. Our disability assistance programs don't provide enough money to allow somebody to rent even an efficiency apartment really anywhere in the country. So if you had adequate supports for folks with disabilities, then you wouldn't, then the disability would not be a cause of homelessness.
So I'll just note, just really quickly, some folks are having trouble finding the chat. There is a little button that you can push on your screen that says chat. Sometimes when you're in full screen mode, you can't see it, but that's the way that you can access that. So I see another question here that is about coordinated entry and assessment tools. Did you consider those at all in your book? And if not, is there some research that you think should happen around those areas?
Well, we do. There is a chapter in the book that we didn't talk about, or a whole section of the book that we didn't talk about much, which is what what communities are doing on a community level, on a system-wide level to work on homelessness. Obviously, coordinated entry is one of those things. Coordinated entry is great. The tools that are currently used to prioritize people for permanent supportive housing or for rapid rehousing have never really been validated. So I need to work, we need to find out what those tools really do. Are the questions framed in the right way? Are they weighted in the right way? You know, what really are the outcomes of using those tools? There's been a lot of discussion, I'm sure a lot of people in the audience know about this, about the fact that those tools can put people who are not Black or brown at the top of the referral lists because of the way in which different kinds of disadvantage get measured by those tools. That's obviously an issue that we need to work on.
We have a couple people that have been also asking questions about encampments. Essentially, what we should do about them, how do we alleviate them and create win-win situations for communities and people experiencing homelessness.
Well, I mean, it all comes back to the housing affordability crisis, of course. But communities need short-term solutions to encampments. Lowering the barriers to entering shelter is part of that solution, very important. The effective outreach and engagement is clearly important, but outreach and engagement are much more successful if in fact what the outreach worker is able to say is that I can get you a placement into housing. People are much more likely to say, no, I'm not even going to a low barrier shelter if their alternative is to be in an encampment where they feel safe, where they have a sense of community, where they have a sense of autonomy that they wouldn't get in a shelter.
But very few people will turn down an offer of real housing that they can sustain, that's independent, that's their own.
Okay. Great. So I see also, you touched upon rapid rehousing a little earlier. We did have a person ask the question about rapid rehousing in conjunction with the current crisis. So communities have CARES Act funding. What are your thoughts on spending some of that funding for rapid rehousing? But maybe we should also ask you about some of the, beyond that, some of the other solutions that communities may be considering that money or using that money for.
I think the best way to use that money, the Emergency Solutions Grant money, is for rental subsidies for folks who are currently experiencing homelessness. Get people into housing. Make those as long as you can. Don't make those 3 months. You know, if somebody has been homeless and they come into housing in the midst of this economic crisis, it's going to be that much harder for them to find a job, to develop an income that's going to sustain that housing. So allow that subsidy to run a little bit longer. I believe it can go as long as 2 years for the emergency solutions grants. And then work with the public housing agencies in your community to make sure that those short-term subsidies are bridges to longer-term subsidies for people who need them. Some people will do fine with a short-term subsidy. 6 months will be enough to get them out and help them to get a job. Many people will need something more than that. And so what you want is not an emergency solutions grant that just drops off after 6 months. You want something that can be sustained, that will bridge to permanent housing. And then for folks who have additional challenges, having additional support services that are available to people after they're in permanent housing is also really important.
So I'm going to ask you just two more questions. One of them seems pretty short, so I'm just going to throw it out there. The individual was asking whether or not the drug abuse and addiction issues we see are the results of homelessness or the cause, and how can you really differentiate? And I guess that gets to some of the issues you raised about sometimes housing being a cure for some of the challenges that people are experiencing.
Mm-hmm. Well, I think it's both and. It's clear that in some cases substance abuse leads to homelessness. In other cases, people don't hit the bottle until after they hit the street. What we found in the case of families was that giving them a housing choice voucher reduced substance abuse. So that's remarkable. We haven't seen that so much for single individuals with serious mental illnesses. There's some studies that suggest maybe that's true, some studies that go the other way. But for families, we found a clear reduction in substance abuse simply by making their housing affordable, by giving them a platform that they could use to deal with their other problems.
And finally, we did have a questioner who had the same question that I had, and that's a good way to end the session. So in sum, if in this political election year, what are one or two items that you think we definitely need in order to, or that would most advance the cause of ending homelessness?
Mm-hmm. Well, clearly the thing that would most advance the cause of ending homelessness is a large-scale expansion of the Housing Choice Voucher program that would enable people who are currently on the border to stay housed. It would make housing authorities much more willing to offer a set-aside of units for people who are currently homeless to help them get into housing. So a very large scale, and we've suggested that 300,000 units a year sustained for a period of time would be enough to end homelessness in the United States. If we have a second choice, we get two, probably source of income discrimination. And just to be clear what that is to say that a landlord can't discriminate against someone because they offer to pay using a housing choice voucher. And as Jill said, that's often used to veil racial discrimination. If we can get to 3 or 4, we'll have some more.
Yeah, I mean, if we have more, then working on the income side of the housing affordability gap, I don't know what's going to turn out to be politically feasible in the coming months and years, but there are a whole lot of different things you could do. One of my favorites is raising the benefit levels for SSI and SSDI. I think that would really go a long way towards helping people with disabilities and elderly people avoid having a crisis that drops them into homelessness.
Thank you so much, Jill and Beth. This was very informative. We definitely appreciate you joining us and sharing your research findings with us today. I also want to thank the audience. You had a lot of great questions that helped really shape this webinar into an interesting conversation. As we close out, I want to mention that we have further segments in this series. The next one will be on October 8th, and it will be focused on youth homelessness and community college students. I know we had one person ask a question that we didn't quite get to there. Hopefully you'll be able to join us again. The speakers will be Sarah Goldrick-Robb of Temple University and Matthew Morton of Chapin Hall. So we definitely invite you to return again and join us for that conversation. You can register for that on our website, endhomelessness.org, on our events page. And there you also see a listing of the other segments in the series. So thank you for joining us today. And of course, once again, thank you, Jill and Beth, for sharing all your knowledge with us. Have a good afternoon.